Center for Better Bones and Alkaline for Life in Syracuse, New York. Today is day 10 of what I'm calling the global day off, the global timeout. Let's call it the global timeout. It's day 10, and we find that New York City is the epicenter of this particular coronavirus epidemic. In New York City, there have been identified over 30,000 cases. That's just somewhat less than half of all the cases in the country. Of course, there's a larger population, there's a big concentration, it can spread more easily, and there's a lot of testing being done. I wish I could say that I thought it was going to stay located in New York City, but it's not going to. It's going to spread throughout the whole country, and we're seeing some cases in upstate New York. So all of us must be vigilant with our own individual programs to enhance immunity, and most of all, going to pay strict adherence to this social isolation that they've asked us to do so we don't contaminate one another so much, and so that we don't overburden the hospitals with so many people getting sick at once. Today I'm going to talk about a few interesting things that I've come across. If you have questions that you'd like me to answer, type them in now and we'll see if we can answer them right in this session here today. And if not, you can write them in and we'll answer them later. I'm going to try to give these chats as much as I can as a support for my clients, my friends, the whole Alkaline for Life and Better Bones community, and we want them to be useful for you and answer your questions when at all possible. It's very interesting what happens kind of serendipitously. Just the other day, yesterday, a colleague sent me an article on the seasonal effect of influenzas, both pan-endemic and non-pan-endemic. And what happens is that most of these strong viruses have a certain seasonal effect, and they're much worse in the winter than they are in the summer. And this article, which was published in 1910, actually suspects that it was because of vitamin D. In the summer, we have more vitamin D. Vitamin D helps to boost immunity. People have more resistance. For us here in Syracuse, that's hopeful. Today is one of the first days that it's warm. It's probably 55, 60 out. The sun is shining. We're all just ready to get outside. And we should get outside because the sunlight will be good for us. Not only vitamin D, but so many other energies come from that grandfather sun to us, and we should definitely get out in the sunlight. And I'm going to get out right after we finish this little chat. But also, we can remember to use our vitamin D supplements. We can get our vitamin D tested, knowing that we want a 50 to 60 level, or at least a 40 to 60 level. If you can't get it tested, and it might not be a great idea to go to a laboratory right now, you can go to grassrootshealth.net. They have little blood spot tests. You can buy a little kit, prick your blood, send it into them, and they'll tell you your vitamin D level. So it could very well be that this virus will be seasonal. Good news, and that we might have a break during the summer. However, right after finding this article, another article came across my desk from the Washington Post. And this is where Dr. Tony Fauci, actually the director of the National Institutes of Allergy and Infectious Diseases, the one who's advising Trump on all these matters, says that there's growing concern that they're starting to see some of these viruses occur in the southern hemisphere, southern Africa, other parts of the southern hemisphere, as they move into their winter season. And what he says if there's a substantial outbreak of this COVID-19 in the southern hemisphere during their winter, then we can expect that we need to be prepared that it's going to recycle back around here in the winter and the fall. So all these things we're talking about, all these things to do the precautions. At the end of this little chat, I'm going to show you a World Health Organization video on washing hands. I never thought of washing my hands for a full minute. I had to watch this video to try to get really serious about it. All the hygiene things we're talking about, all the things about dietary things, about having all those fruits, vegetables, nuts, and seeds. And I'm going to talk a little bit more about what they found out in China, the impact of this disease and how it affects our alkalizing compounds. Measure your pH. The simple way to know. First morning urine, just you want a 6.5 to 7.5. If you need any of the materials, just contact us at Alkaline for Life. We have kits. We have all the information you need. This virus, most viruses do not like a alkaline environment. They love acidity. Get all those antioxidant-rich fruits, vegetables, nuts, and seeds. Measure your pH. Hey, just today. So I was a little rushed, so I made my little lunch here. When I was consulting with clients, I stuck this in the oven. An easy way to make lunch is things you can bake. This is a little free-range chicken that my friend raised, and some very delicious sweet potatoes. I stuck them in the oven, cooked them up, they were all ready. Now, what am I missing in this lunch? I'm missing the vegetables. I'm missing the 2 cups of fruits and vegetables. Today, I got really rushed between seeing clients and trying to get this little chat together for you, so I didn't do the vegetables. I'm going to have to eat 4 cups for dinner. Tomorrow, I'm going to show you a shortcut, the way I usually can very quickly cook up some vegetables and how to make them tasty. The diet is very important. Now that you're home, take time, maybe learn some new recipes, do some cooking. We sent some recipes around, and one person wrote back and said, wow, now I know why I don't cook. It was a man. He said, because it's just too much work. There's lots of easy ways to cook, lots of shortcuts, and I'm going to suggest you start looking at those alkalizing foods, the fruits, vegetables, nuts and seeds, the spices. Think of ways to use more spices. They're really very potent enhancers of the immune system. So Dr. Fauci's saying that we should be prepared for this to come back. We can be watching. He said if you see in the southern hemisphere that this virus is really booming, then we should pay special attention to that. Of course, there's many ways to enhance immunity, and you'll see all of these, many professionals are offering their ideas. We are very dedicated to the science of vitamin C, and we encourage people to get these little vitamin C sticks to know that they always have amount of vitamin C that they're excreting in their urine. There's certain types of vitamin C we like that are more alkalizing, but sometimes they're hard to get a hold of, so we're happy to help you out with what we can, but even a high quality ascorbic acid. Keep your vitamin C up. And as time goes by, all of us are going to get more prepared, and we're going to learn how to really enhance our immunity like full time, all the time. The seasonal thing is really very interesting, and it does remind us that then we have to pay attention to the diet. Then the next study that comes up on my desk is a study actually about the diet quality amongst the American youth. And this was the NHANES study. That's our national survey of the whole population. It's a very large survey. This was in 2016. And what they found is that half of the young people have poor diets. And that's actually improved a bit from the years before that. But it's so very important, maybe now when we're all home and we're home with our kids, and maybe once again we're going to cook family meals. Very good idea. The children must be better nourished. They must have the same kind of alkaline diet, fruits, vegetables, nuts and seeds, whole foods, in order to keep their immunity strong. And in order to avoid, in later life, having to use drugs and medications. You've probably heard, as we sort out this data and the data coming from China, some people are much more vulnerable to this to virus setting in their body and taking charge of their body. And those people are often people on certain medications, like some of these blood pressure medications. They're just discovering all the possible interrelationships between medications. On the one hand, we're looking for medications that we've used before, like anti-malarial medications, to see if they can help destroy this virus. And on the other hand, we're seeing certain medications make us more vulnerable to this virus. And I may get some people who know much more about this than me to come talk, but what our concern is, always know that we want to try to live as natural a life as possible and find the solution to our problems without going to drug therapy. When it comes to things like hypertension, diabetes, diabetics are much more vulnerable to this disease to this virus than the average person. People with hypertension are more vulnerable, people with heart disease, and all these are diseases that have been created by our modern lifestyle. So maybe in this global timeout, we're going to all sit down and think, hey, do we need to rethink our lifestyle? Do we need to see what's really important and sort out how we want to care for ourselves, how we want to care for the planet? The children need to be better nourished, that's for sure. It's interesting, there's many great minds are searching thousands of drugs that we know. They're putting it into these vast computers to see which ones may possibly help with this virus. We know that people are working steadfastly on a vaccine, and that one day will happen. But in the meantime, we've all got to take some special care. Science News, I can send you the Science News. Science News is interesting because every day you can subscribe that they'll send you the updates on technology, the updates on health, many different updates they have. I'll give you the link in case you're home, got a little time. You want to see what the scientists are doing. One of the things the scientists did recently was to study COVID virus and tears, and they say that it cannot be transmitted through tears, which is really interesting. And another thing that they seem to have found in China is that mothers don't pass it on to their children in utero. It's a very interesting kind of thing. Science News, you might look at the link. You might sign up if you want to know a little bit more what's going on. They have releases every day, and they talk about what's happening a lot, what's happening new with the research on COVID. You know, one of the last things I wanted to chat about was they're now, of course, looking at the studies from China and looking at the patient histories, and they find many of the people who get this disease develop very low potassium. And it appears as though part of the process of the disease is that it causes the body to excrete potassium. And giving these people potassium was very helpful. And they gave about 3,000 milligrams, actually. Now, potassium is not going to prevent you from getting disease, but potassium is one of these really important nutrients. That's one of the alkalizing powerhouses, and we consume half of the potassium that our government says we should. The recommended intake of potassium is 4,700. That's like 5 times that of calcium, and yet the average person only consumes maybe 2,500. This is because potassium is found in all the fruits, vegetables, nuts and seeds, beans, things like that. We just simply don't eat enough of whole foods. I have a list of high potassium foods on betterbones.com, and you can look it up. You can think about, how can I get more potassium foods? You want to keep your potassium at a nice level, at least to get the government guidelines of 4,700, which, by the way, would be equivalent to about 13 servings of vegetables, fruits, nuts, seeds, and spices. So almost all of our food has to be whole food if we're going to actually get enough potassium. They also found that, that potassium is a very interesting thing. It definitely gets very low, and when they gave the people potassium, they did much better. So let's all go into this flu season with adequate potassium levels. You can tell partially by the pH, because the potassium in the fruits and vegetables, nuts and seeds, is in the form of potassium citrate. And the body converts that citrate into bicarb. So it's a very strong alkalizing agent. Okie dokie. So you might check out Science News. You might check out the Washington Post article on the seasonality of the virus. As I mentioned, before I answer a couple of questions, I want to mention that I thought I was pretty impressed looking at the World Health Organization instructions on how to clean your hands. I definitely am one of these people that cooks everything on high speed. I move on high speed, but washing your hands I've really got to make a big effort to slow down. It's actually very instructive, and it'll show you how to do a proper hand washing, which really takes quite a few minutes. A wise thing to do. We should all be thinking about that. You know, talking about pH, a question people ask us, and I've been asked recently, is, well, if I want to alkalize, why don't I just take sodium bicarbonate? And there's a lot of reasons why I wouldn't recommend that. One, we don't need any more sodium in the system. Two, that's not really a great food grade supplement. And bicarbonate will decrease the hydrochloric acid in the stomach. So you want to take a form of alkalizing compound that the body really needs, like potassium bicarb would be better to use. Or what we use is an ascorbate, that is attached to minerals. Ascorbate will alkalize just as well as bicarb or citrate will. So yeah, I would try to get the fruits and vegetables, nuts and seeds, and if I could get ascorbate, a buffered ascorbate, which is that form of vitamin C that the body uses in the body, I would do that. And I would skip the sodium bicarb if I had any other choice. So day 10, let's all take another deep breath and send a word of thanks to all the people here in New York, particularly on the front lines that are working at those hospitals, that are really putting their lives on the line to help individuals who have been overwhelmed by this virus. We have a shortage of supplies. We need to be thinking, how can we get more masks, more gowns? Our governor is working very hard to do that. If you have any creative ideas, what did I just saw? Some church found they had 5,000 masks hidden away in their storage. They sent them to New York. Let's see if we have any creative ideas to help out. In the meantime, help your neighbors, help your family take care of yourself, and know that we'll be tomorrow showing you some tips about vegetables and how to make those quickly. In the meantime, stay well and know that we're thinking of you, and we